In this episode of Ask Me Anything, I got a great question from a massage therapist in Virginia asking about carpal tunnel syndrome, how to treat it, how to manage it, and if the client should continue to come in for conservative care. What's up, everybody? Dr. Matt Mazur here, creator of the Peak Method, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% and easily double their income. Back at it for Ask Me Anything. I got a great question from a massage therapist in Virginia. And the question was, I have a client that has had four carpal tunnel release surgeries, 2 on each side. Every time they get it done, the symptoms improve for a few weeks, but end up coming back. I want to be able to help them out and believe there must be a tissue component, specifically in the soft tissue, to the issue. Just don't know where to look or where to start. Also, should I be worried about working on an area that already has had so many surgeries? Thank you so much for sending that question in. And let's just start it off this way. Anytime you see a diagnosis with syndrome in it, it's just code word for bullshit. They have no fucking clue about what's going on. Carpal tunnel syndrome, patella tracking disorder syndrome, all things with syndrome is just they don't really know what's going on. I always talk about the idea that you have to have a tissue specific diagnosis to a problem because you cannot fix it if you don't know what it is in the first place. I made a whole webinar about that. If you're watching this on YouTube, I'll link it up here. The 7 potential problems in the human body. Carpal tunnel syndrome does not tell us anything in that regard. And you're seeing this as well, especially in the surgical type of place. You know, people tend to focus more on what I call the effect instead of the cause. So they go, oh, well, they're having numbness and tingling down through the hand. They might even do this sometimes. These doctors do this as well. They go, oh, well, you have numbness and tingling in the hand, must be carpal tunnel syndrome. They don't really even get specific about like, where is it coming? You know, a lot of times they might just, oh, your whole hand is numb or tingling, it must be carpal tunnel syndrome. It's such a reductionist bullshit approach to trying to find and fix a problem. It doesn't get you anywhere. And a lot of times, if somebody is having an issue further down in the hand and down in the arm, unless they got that area crushed, like someone jammed a hammer on there, slammed their car door over their hand, the problem is actually not going to be there. And we spend so much time, we waste so much money in medicine, in treatment, and all this bullshit on treating the effect instead of the cause. And this is exactly what is happening to this person. They keep getting diagnosed with bullshit carpal tunnel syndrome. They go in there, release it, and then the problem comes right back because it is coming from somewhere else. Nobody really wants to critically think in healthcare, in medicine. We just want to go in and be like, well, there's symptoms there. We got to go in and just get rid of those symptoms. There's other people on the other end that are like, well, symptoms don't matter at all. It's somewhere in the middle. Symptoms tell us there is a problem, but we have to interpret those symptoms correctly and think critically. That's what I teach in my methods and my trainings. Learning to think critically first, like being able to figure out exactly what the problem is, because you cannot fix that shit if you don't know what it is in the first place. So carpal tunnel, what is really going on with that? Usually what I find is it's getting caught somewhere else higher up in the chain. So there's these things in the body called nerve entrapments. There's 256 different places in the body where a nerve entrapment can occur, and they get caught in a lot of areas. Nerves are built with like extra slack to keep them healthy as they make their way through muscles, like 15% of extra slack. And a lot of times what I end up seeing in a bullshit carpal tunnel diagnosis is it's usually caught somewhere up higher, specifically in the nerve roots at the scalenes, then underneath on the subscap in there as well. And then it gets caught as it goes the rest of the way down. They keep releasing in here. They free it up for a little bit, but it comes right back, which is a problem. That is a problem across the board. So I actually find in my clinics the most common site for carpal tunnel or pain down the arm, even being like lateral elbow, medial elbow, ulnar nerve problems, everything kind of starts at the nerve roots, at the scalenes. These muscles get really jammed up. So what I wanted to include in this AMA is a detailed treatment of the nerve roots at the scalenes, breaking down that scar tissue, because a lot of times that's where the source is coming from. That's from the cause. If you can free it up here, it'll get rid of the symptoms down here. So I'm going to link that video up first. We're going to be treating the nerve roots at scalenes. I wanted to show here with the model, just so you can get a better idea of how the setup is. The key here is we're only going to be going a very short distance, but when these nerve roots are really caught up and create a lot of problems with overall functioning of the neck, can cause some pain down the shoulder, back through here as well. So symptom location is really key. And when you're seeing a limited test, when they're doing that upper cervical functional test, what's going to happen is it's going to refer some pain there. So if you can clean these up, it's going to make a big difference. So coming a little closer here. So the way that I'm going to set up is you're going to have the client right here, and the top of their shoulder blades will be right off the edge of the table. And then you're basically going to have your hands cradled just like this. And this, say we're treating the left side, so the top hand is going to be our support hand. So what I like to do is I count some landmarks from where we go, and then down. So we go down here, and the first one you're going to find is at C7. So I want you to go 7, 6, 5, 4. And that's where you're going to hold and cradle. And it's going to go just like this. And then you're going to bring the other hand around just like that. And then everything is going to be nice and supported. And you're going to be able to fulcrum and open that up. Because what we're treating in here is these nerve roots, and the scalenes go over top. So this will really help you with the palpation. So we're going to create a fulcrum. You see how my hands are here. And what you're going to do is open it up just like that. You have a little bit of tension, and we're going to go in and feel on each one of these nerve roots, and we're going to find the area that's the least compressible, because that's where that scar tissue is. So what you're going to do is sink in and see what you feel. So first you'll have the C5, C6, then you'll have C6, C7, and then C7, C8. Those are the three that you're going to work in there. So when you find the one that compresses the least, that's where you're going to want to treat. So the way the treatment is going to work, you're going to be in just like this, and what you're going to do is start them in neutral. And say we're going to treat the C6, C7. So we're right here, my thumb is here, and we're going to use the pads of our thumb to open it up this way. That's going to allow us to get in there. We're going to be nice and relaxed. And then the first thing we're going to do is we're going to get some depth with a pec push into there. And then we're going to come out just a little bit. Normally we come out 10 to 20% when we're treating just scar tissue, but since this nerve is here and it's deep, we're only going to come out 5%. Now, the next thing you're going to do is you're going to get your tension with a body lean like that. You're going to get right over top of that. And you want to pause just before that happens and hold that. And the way the motion is going to work is you're going to take this left foot, and this is going to be your push foot, and your right foot is going to pull. So what you'll feel is a slight push and a slight pull as I bring it through just like that. And we're not going very far as we go through, because we're only treating that one level as we go in there. And only treating that one level as we go in there. So this is actually going to be what's called that internal slide. So when you set it up just like this, you're here, your depth comes with your pec push, your tension comes with your body, and you're gonna push with that left foot and pull with that right, and you're gonna force that to roll over your thumb, but you're not going to move your thumb, and it's going to come from there. So I'm going to show what it looks like on an actual client. So once again, positioning, you're going to have them come to the edge of the table, just like that. One more scoot back. So their shoulders are here, and their head's going to be cradled in here. First step you always want to do is have them tuck their hands under their butt. It's going to help everything relax. So say we're treating that left side like we said. This right hand is going to be there. We're going to go in and count. We're going to have C7, C6, C5, C4. I'm going to create that knife edge and just hold there and see how it's nice and supported there. From there, and now the next one we're going to go in and we're going to start to palpate those different regions. So we want to use this thumb as a fulcrum to open it up as we're palpating. And we're going to sink in first, and that's 5, 6. Just push with that pec and see, is that compressing or not? Then work our way down. That's 6, 7. And then we're going to go 7, 8. In whichever area feels like it's not compressing enough, that's where that scar tissue is. So let's say this one's at C6, C7. I'm going to start here nice and neutral. My arms are nice and relaxed on my side. And what I'm going to do is take this right hand and push it into my left. That allows my thumb to sink in there nice and easy. Then what's going to happen is I'm going to get some depth by pushing with my pec, and my tension is going to be that body lean. I'm going to be nice and loaded, and as we said, I'm going to push with this left leg and pull with the right, and we're going to go nice and easy, and I'm going to keep that pressure and that tension and let that slide over my finger. I'm not sliding my finger, I'm letting it come to me, because that is internal slide, not external slide. So the key is palpate it under tension. Once it's there, you're going to fulcrum that in, nice and relaxed, and you're going to get that pec push for your depth and a body lead for the tension. And then you're going to push with this left and pull with that right and have it go through just like that. Good. Well, I hope you got something out of that video. Understand that if you get the right depth, the right tension, you can break scar tissue down and free up nerve entrapments. Nerve entrapments are really common and they're often missed by a majority of practitioners. Like I said, they present with numbness, aching, burning, tension, and can cause a lot of those issues in there as well. I'm going to go on a little mini rant about how broken the medical system is and just how fucked up it is. You know, this person has had 4 carpal tunnel release surgeries. Obviously, that shit isn't working, but the doctor continues to get paid more and more. So let's look at it from the doctor's standpoint. The medical system messed up because we only pay based off procedures and not results. Imagine if we actually rewarded the doctor for doing good work and figuring it out and only doing surgery if they absolutely needed to, and we would fix the problem. On the other end is just the client and the patient themselves. Surgery doesn't require you to do a lot of effort. It doesn't require time, energy, and focus. You think you're going to go in there, get this magical surgery, and you'll be good to go. From the practitioner's standpoint, we're not taking a lot of time to figure out exactly what's going on. The evaluation, the diagnostic components just aren't there. We're just trying a bunch of shit and see what happens. Like, whoa, it's tingling in here. Let me treat a bunch of stuff and see what happens. That's what I call a shotgun approach. What I teach in my methods is a sniper approach, really figuring out exactly what's going on, knowing where that tissue is, knowing the right types of questions to ask so you can get in there and be a sniper and get the area that needs to get it. Don't be afraid of treating these people, especially if they've had surgery, because they're going to get fucked across the board anyway, because they're not getting their problem fixed, continue to get worse and worse. Be someone that actually thinks first, be that clinician first and think first, then become a technician. Don't just want to jump right into the treatment right away. Slow down, ask the right questions, think critically, and get on that level to being that true solutions provider in your area. So appreciate you sending in this question. I hope it helps. I know I got a little ranty there, but the medical system is just so fucked up and it's getting worse and worse. And I really believe with all my heart and my soul that all these problems are coming because the conservative care model sucks on the front end. People aren't getting the right type of treatment. They're going to like chiropractors and physical therapists who don't do a whole lot of anything. Then they're getting injections, pain pills, and all that kind of stuff, only to have surgeries on the back end. We as soft tissue practitioners are the missing link, but we have to change the way we do things, the way we approach things. Think critically, figure problems out, solve them, and provide solutions. That's all I got for you guys. If you like the video, give it a comment, a like, or share. If you got any questions you want me to cover, send them in. I'm always happy to help. And lastly, go grab my free training. I put a lot of effort and a lot of time into that free training to make it better than anything else out there. You'll at least get on the path to thinking critically, figuring out problems, working smarter, not harder. And if you really like that, and you like what I'm sharing and I'm doing, then you can come and learn from me, but only once you start there. I appreciate you guys, and thanks again for that question, and I'll see you on the next one. Bye.